Good morning, folks. Certainly a lot going on, and I certainly have some information to share with you this morning relative to COVID, both within Canterbury Woods at both campuses and obviously the greater community, as I know everybody's paying attention to what's going on out there. First, just kind of an update to, we're always going to tell you with brutal honesty the challenges that we're facing with COVID. So at this point, I can tell you that here in Williamsville, we have 2 independent resident positive cases. We have 1 positive case in skilled nursing. I can tell you that the resident who tested positive in skilled nursing, which came about on Friday afternoon, has since been transferred out of Canterbury Woods to another facility in Western New York that specializes at this point in treating all COVID positive skilled nursing residents. And that's done at the direction of the New York State Department of Health and in concert with our medical director, Dr. John Bodkin. And really, the reasoning for that, of course, hopefully everybody can understand, is that when we only have 1 resident in a skilled nursing environment, it is much more effective in terms of treating that resident and safer for not only that resident, but the other residents and staff within the skilled nursing to transfer that person to get COVID-specific care rather than caring for that person in, let's say, Oxford Village skilled nursing and daily, hourly risking the possibility of that person spreading COVID to other residents and staff members. So that's why that decision was made. Let's hope down the road, in the event that we had multiple cases in skilled nursing, probably we would have no choice and have to keep them there here at Oxford. But at this point, for being ultimately conservative and trying to come up with the best solution both for this resident that tested positive and the other resident population down there, the decision with the direction of the New York State Department of Health was to transfer that person. We also have 1 independent resident positive case at Gate Circle, and that came about as a result of the contact tracing, some additional contact tracing that we did there on Friday evening. So as a result of that test, and again, that's why you do contact tracing, right? So we did effective contact tracing based upon a possible exposure. We did find 1 independent resident who was positive. And a result of that, we are testing dozens of residents there, tested some yesterday and more today as part of our ongoing contact tracing. I can tell you that as a result of the cases that we have here, we have tested dozens of staff members and dozens of residents here in Williamsville as well. And that's really the benefit of having the antigen testing that we have available, that we invested in, that we can do immediate testing here on site rather than having to send them out and waiting, et cetera, et cetera. I can tell you that we've gone through several hundred antigen tests, and we have actually had to order another 1,000. So hopefully those will get here before we run out of the ones that we have. Antigen testing supplies are becoming harder and harder to get throughout the country, as you know, because there's a lot of testing going on. So we placed that order actually 2 weeks ago in anticipation of more use. So hopefully we'll be able to get those on a timely basis. We will continue to contact trace as necessary. So if you're a resident or staff member, you don't hear from us, chances are great that we have established that contact tracing for you specifically is not needed based upon the events that we are investigating. But folks, I can tell you this, that we're not done with cases. There's going to be more cases. And we're going to continue to do our best when we have positive cases to isolate them, to contact trace, to deal with them on a one-on-one basis, because every case is going to be unique. I implore with you, to everyone, staff and residents, please be ultra-conservative in your lives for the next several weeks. I talked about it on Friday. I'm going to talk about it till I'm blue in the face here now. For our residents, those of you who don't have to go out, don't. If you have to go out, wear your mask. Stay away from people. Don't socialize. Be very, very, very cautious. So as a result of that, really maybe the big news of the day is we are canceling sit-down Thanksgiving dinner for Thursday. I know this is going to be disappointing for most of the residents who had planned on that, but really with the cases now that we have at both campuses, so this is a cancellation on both campuses for sit-down Thanksgiving dinner. With the cases that we have on both campuses, the fact that even though we are doing contact tracing and doing antigen testing, even though people are testing negative at that point, again, if you heard me talk about, it doesn't mean that a day from now, 3 days from now, 5 days from now, we're not going to have more positive cases. So out of the abundance of caution, really, I struggled with this over the last day or so, but we are going to cancel Thanksgiving. In terms of sit down, obviously we will have full Thanksgiving delivery to all of our residents, Thanksgiving food. And you'll hear more from our dining staff about how we're going to pull that off within the next day or so. But this will come out in writing and over Touchtown about the cancellation of sit-down Thanksgiving dinner on Thursday. Apologize for this, but really at this point we see no other choice. The other issue that continues to come up is the mandatory testing for personal care aides, family caregivers, etc. And it's a challenge as well. I mean, we have many personal care aides and other folks that are coming in to care for our independent living residents. Of course, many of our independent living residents need that care on a daily basis, and we get that. And so we're trying to walk that line, please understand, with multiple things. Your personal caregivers that come in here are exposed. They are out in the communities. They may be caring for other residents in other organizations, or multiple residents here at Canterbury Woods. So please keep that in mind. So from our perspective, while we certainly understand and want to make sure every single resident gets the care that they need from their personal caregivers, we also want to make sure that we do everything we can to control the spread of COVID within Canterbury Woods. So there's a fine line there. We have had multiple personal care aide / family caregivers over the last week or so who are getting tested outside of Canterbury Woods in the various ways that you can get tested out there, and aren't getting their tests back timely. So again, they need to have a negative result within 7 days to be able to continue to be led into Canterbury Woods, and that's not going to change for this foreseeable future. But some people aren't getting those results back, and we understand that, and I know it's maddening and frustrating, and I get it. And I've gotten those calls. So there's a fine line there, because you need that care. You don't have a negative result. Do you take a chance in letting that person come in and provide care and possibly infect the resident that they're providing care to? I can tell you this, that we have had a couple of personal care aides test positive for the virus as part of this testing. That is, and they're not employees of ours, but that has happened. So it's the reality. So here's what I would suggest. We here at Canterbury Woods, of course, we offer the PCR test, and we have availability almost every day of the week. We are still getting results back on that test between 4 and 5 days from our lab. For those residents with personal care aid that are going other places, they really should consider just getting tested here or at Gate Circle, sending them out to our lab. Yes, there is a charge, it's $80, but folks, I mean, is it worth it at this point to get that done, get the results? You know, chances are we're only, you know, we're light at the end of the tunnel. So maybe, you know, maybe you have 2 more months of going through this before everybody, you know, at least the elderly folks get their shots and so on. We want to work with you, but at the same time, we want to keep everybody safe. Not only the individual resident who's getting care provided to them, but if that resident becomes positive, then of course it risks community spread. So that's the line that we're walking here. I would encourage residents with personal care aides to direct them to get their tests here at Canterbury Woods on a weekly basis. We are still getting results within that 7-day window. For the interim, because this is becoming an issue, if residents and or family members choose to have a non-tested or non-negative resulted aid come into their resident and provide care, we're going to, at least for early this week, give you the opportunity to do that as you continue to figure out the testing challenges. But if that happens, if an aide comes in and the family or resident says, yes, I want that aide to come in, and they don't have a negative test that's been negative within the last 7 days, if they come in to provide care, that resident will have to quarantine in their apartment for 14 days. So let me say that again. Because we know that there are some challenges out there with getting tests back within 7 days, we're going to work with you on that. We will allow you, at least for early this week, to choose to have your aides to come in, even if they don't have a negative result. You still have to go through Dawn, and you still have to get them on the list and explain why they don't have a negative result. But your family member, the resident, will be quarantined for 14 days as a result of that decision, for obvious reasons, because we just don't know. So that's where we are. We would encourage everybody that, again, if they're having problems getting tested, getting their aides tested, to get tested here at Canterbury Woods. I've gotten a lot of questions also in the last couple of days of just having them come in and get antigen testing. Can my aide get an antigen test? That's the 15-minute rapid test. And the answer to that is no, they cannot. Those tests are not available to personal care aides or family caregivers, simply because they are in short supply and we are going to hoard them. We're going to use them for contact tracing. We're going to use them for outbreak testing, those type of things. We went through a couple hundred of those tests in 2 days this week. We had about 1,000 on hand. Overall, we're down to about 500 on hand. We've ordered more. I don't know when they're going to come in. So because we've invested in those tests, we're one of the few long-term care organizations. In fact, I don't know another long-term care organization that has antigen testing at that level available to them. We're fortunate that we do. So we can do immediate contact tracing rather than having to do PCR testing and waiting, which it would be terrible. So we're going to hoard them a bit, and they're just not available for kind of one-off testing. Again, please, let's be patient with each other. I say this to our staff here every day. We have a lot of, everybody's A lot of pressure here at Canterbury Woods amongst the staff. Everybody's working really, really hard to keep everybody safe, residents and staff included. Let's be patient and certainly be patient with each other in our daily lives. I guess I have to remind myself of that and say it out loud because I can be as impatient as anyone. Be well, wear your mask, social distance. Email me directly with any questions, rwallace@echa.org. I apologize if I don't get back to you immediately, or if I get back to you and it's very short, I'm obviously getting a lot of questions shot our way. That's good. Don't hesitate to send out a question. Let's just be patient. Thank you, and I will be back here on Wednesday.